All right, everybody, we've got a guest today with us. We have an interview coming up. Joining us today is Dr. Muhammad Alaa Aldanasoury, Chief Medical Officer, Consultant Chief of Cornea and Refractive Surgery Units. He is a leading expert in cornea and refractive surgery and one of the early pioneers of laser vision correction. And he's been at the forefront of advancements in eye care and is a well-known voice in international ophthalmology circles. Hello, good morning, Dr. Muhammad.
Good morning, Dr. Noreen.
How are you?
Thank you for having me.
Well, good to have you
Very
with
well,
us.
thank you.
Very good to have
Thank
you
you.
with us today. We have a few questions for you. As one of the earliest surgeons to perform laser vision correction globally, how would you describe that pioneering experience? And how has that field evolved in terms of technology, safety, and clinical outcomes?
This is a great question because, it brings very good memories. And I was privileged.
Sorry, Dr.
maybe
Muhammad.
lucky.
Dr. Muhammad, are you on speaker? Are you on speaker?
I'm using the phone. Is it better now?
If you're not on speaker, it would be better.
Yeah. No, I'm not on speakers. Is it better now?
Yeah, okay, let's go.
Okay, so I was saying I was privileged to be part of this pioneering experience. I was, even Allah subhanahu wa ta'ala, I was in the right place at the right time. I remember in the early 90s when we started to embark on the laser vision correction. That was the early days of the excimer lasers in the early 90s. We felt like stepping into the future. At that time, the technology was very new, was untested, was kind of revolutionary. But yet we believed in the science of it, and I still remember very clearly the very first days of the laser surgery when we were seeing the joy and the emotion of the patients.
Wow, yeah.
And then fast forward now, today, the field has transformed beyond anything we could imagine at that time. In the early days, the procedures were groundbreaking at that time, but still had limitations. But today, the precision is incredible. The safety is extremely high. With the ultra-advanced femto lasers and wavefront guided treatment with artificial intelligence. I believe that today patients are enjoying a faster healing, a faster recovery, incredible experience with vision correction, options that were not existing before, were not possible before.
Yeah, I'm sure. All right, so you introduced advanced procedures such as LASIK and something called phakic IOLs and intracorneal ring implantation to the region. What were the main clinical and organizational challenges that you faced during that transformational phase?
Well, it's always challenging to introduce new procedures, but first you have to believe in the product, to believe in the procedure. And we believed actually in laser surgery, laser vision correction. We believed in the phakic intraocular lenses and other new procedures. We learned from the very beginning that, this is exciting, but also they're helping patients to improve their lives.
Yeah.
So the main challenge was to build the right system, which is not easy, and it takes years to build a system that support this new technology. It's not only about technology, but it's more about people.
Okay.
So training the medical teams, creating educational programs, bringing the up-to-date advanced equipment. And this field is evolving and changing every day. Every day there is something new.
Of course, yes.
So being always in par with the best solutions available worldwide is not easy. So that's a big challenge. And also always when you introduce something new, there is always skepticism, and it takes time for the community, even for the medical, for the doctors to believe in the new technology.
Oh, wow.
So I remember when we started doing the laser vision correction, we were the first healthcare facility to have the excimer laser outside the United States. That was in the early 90s.
Wow. Okay.
Today, mashallah, there are hundreds, maybe thousands of laser centers all over the Middle East.
Yes, yes. Wow. All right. Now, around the age of 40 and over, a lot of people begin to experience what is called presbyopia. What are the most effective current options for managing these age-related near vision loss? And do reading glasses, are they the safest option still?
Well, actually, presbyopia is a natural change that happens with age, usually, as you said, around the age of 40, maybe 45, because the crystalline lens started to lose its elasticity and transparency. The simplest way, of course, is to use reading glasses.
Yeah.
But it's safe, non-invasive, it's affordable, but it's always inconvenient. And those people who are using reading glasses know very well how it's inconvenient to have reading glasses everywhere on the desk, in the office, in the living room.
I know exactly. Yes.
You don't sound presbyopic.
Thank you.
So always the option of getting rid of the reading glasses is always appealing. So there are some options that can improve the near vision permanently, including LASIK, femto LASIK. It's called presbyopic LASIK. And there are many types of presbyopic LASIK that has to be customized and individualized for every single patient. It's not one treatment fits all. It has to be really customized.
Yeah.
Most of the patients can benefit, but some patients do not. So with the modern diagnostic equipment and some experience with artificial intelligence, it's very easy and possible now to know who will benefit from this kind of presbyopic LASIK. Also, the other way which is very promising, and it has been around for almost 10 years now, is the multifocal lenses. So this is a kind of surgery that where we exchange the crystalline lens inside the eye.
Yeah.
That starts to become less elastic and less transparent. And we implant a lens that has both prescription for far and near.
Oh, okay.
Again, selecting the patient is most important for this to have a successful surgery.
Yeah.
And if properly selected and if the surgery is properly done, patients are really over the moon. They are so happy with the far and near vision.
Wow. Yes. Okay. Let me ask a bit more about this. They have to take calculations and measurements of the current lens in order to choose the right lens to replace it with? Or?
Yeah, absolutely. There are lots of measurements. The most important is measuring the quality of vision.
Yeah.
Measuring the current quality of vision of the patient, measuring the dimensions of the eye, because the power of the lens depends mainly on the curvature of the cornea and the axial length, the length of the eye. Okay. So very accurate power calculation is important. It's crucial in this kind of surgery.
Yeah, I'm sure. All right. Wow, great. Okay. Thank you so much for joining us today, Dr. Mohammed Alaa Aldanasoury, Chief Medical Officer Consultant, Chief of Cornea and Refractive Surgery Unit, Magrabi Health. Thank you so much for your time and your expertise answers.
Thank you so much for having me today.
All right. Have a great day. Thank you. Bye-bye.
You too. Bye.